when they're pregnant, and is going to share his own experiences. I'm going to first deliver Zekeriya Yelboğa's presentation, and then I will be delivering my own presentation. Anxiety and depression in women is common, and one of the contributing factors to anxiety and depression in women is pregnancy and some consequences of pregnancy. And we believe that psychiatrists and psychologists should actually investigate this area. And we were working on this, and in the meantime, Zekeriya Yelboğa's daughter had a problem, gynecological problem, and she was taken into emergency surgery, and Zekeriya Yelboğa had to leave. So being a woman is difficult, and this gynecological emergencies also show us that even before pregnancy, womanhood is difficult. So Zekeriya Yelboğa's daughter underwent a laparoscopic surgery, and he's smiling, as you see, because his daughter is fine. This is a painting by one of Zekeriya Yelboğa's patients. This is a painting by a woman who had repetitive miscarriages. As you see, the loss of a baby, and she repeatedly paints the same theme. Let me start with a couple of cases. 19 years old, married for 1.5 years, graduated from high school, housewife. The maternity clinic was asked to consult for symptoms of insomnia and irritability. Previously, there was no history of psychiatric diagnosis and treatment. He had 2 carriages. The interval between the 2 was 6 months. Her first miscarriage was at the 3rd month of the marriage. She was 1.5 months pregnant at that time, and she didn't understand what happened during that miscarriage. And then she started feeling intense guilt, frustration, unhappiness, uncomfortable sleep and nightmares, and she was demotivated, nervous, and as of starting from her miscarriage, she often re-experienced this bleeding effect, and also she had flashbacks of that miscarriage moment. And the second pregnancy was at the 9th month of the marriage, and she had a second miscarriage, and she starts to check her underwear 20 times a day in a compulsive manner. And then she started to feel nervous during sexual intercourse, and she was thinking, if I am pregnant now, do I lose the baby because of this sexual intercourse? And she cannot go out, and she doesn't want to see pregnant women or babies, and she feels lonely, desperate, and insufficient, and the IES score is 72. This is another case, 28 years old, married for 5 years, a teacher. She had repetitive miscarriages. She was monitored in the gynecology department, but she had persistent back pain. She was then referred to Zekeriya Yelboğa, and she had 3 miscarriages, and the pregnancy did not last longer than 8 weeks, so she lost all her babies in the first 2 months. She had nightmares, and she sees that the babies were burning, or the baby's arms and legs were torn off in her dreams, and she didn't want to sleep because she was scared of having nightmares. When she sees a pregnant woman, she gets angry, and she couldn't stand the relationship between parents and students, and she has recurrent waist, back, and shoulder pain. She had concentration problems and forgetfulness, and the IES score is 62. The DES score is 36 with this patient. In the IES scale, when when it is more than 30, then this means excessive problems that might even have an impact on your immune system. And EMDR was used for 12 sessions, and then the patient gets pregnant again, and she is at the 7th month of her pregnancy now, and hopefully she will have a healthy baby. Another case, 32 years old, married for 6 years and had a 5-year child. She's an agricultural engineer. 11 months ago, her 8-month-old baby was removed due to diaphragmatic hernia, and then the baby died. She has psychomotor inhibition, withdrawal, decrease in interest in her other child, suicidal thoughts, intense feeling of guilt. She did not go to the cemetery, and she believes that she's a bad mother. She doesn't want to see she's a new baby, and when people say you are young, you'll easily forget, she doesn't understand how people can talk like that. She cannot lose weight. She doesn't want to cook. She does not take care of her child. Sometimes she's aggressive towards her child, and the child starts to have nightmares and bedwetting, etc. She has repetitive nightmares, and she is really angry and pissed off at the gynecologists and obstetricians, and she has terrible nightmares. After 3 sessions of EMDR, she goes on a diet, and she starts to take care of her child, and she starts to play with her child, and the child does not wet bed anymore, and then she visits the cemetery twice, and this means that the pathological mourning is coming to an end. And before coming here, she started working, and the nightmares were less. So these were cases. Now I am going to go with the presentation. The pregnancy starts psychologically even before they get physiologically pregnant. A lot of girls start playing the mother when they're really young. I mean, years ago this psychology starts, and it's a step towards motherhood and fatherhood, and fantasies, dreams, and new goals. These are all felt by the mother. Actually, pregnancy is a unique experience. Cultural factors, personal history, personality, relationships, and social environment all affect pregnancy. Pregnancy is also a critical period of no return. It's a developmental crisis. When there is a problem with pregnancy, then it's a crisis in crisis. When there is pregnancy and then loss, it's not only the loss of the baby, but also the loss of the value of self, the sense of failure, and also loss in reproductive capacity, loss in being healthy and normal, loss of control, loss of innocence, relationships, family. So in many areas the patient feels lost, and this might be different types of loss. Each year almost 900,000 families are affected by birth tragedies. 800,000 miscarriages, 33,000 stillbirths, 18,000 neonatal deaths. 1 in 3 or 4 conceptions end in loss, and 25% of them are in an early period. Late losses generally constitute 2 to 4% of all pregnancies. And now miscarriages. Some studies report that no emotional changes were observed in women. However, some women might have this loss of control, desperation, fear, and anxiety. However, most of the studies report that women have these emotional changes. The human brain is really strange. Even though you don't feel the pain at that moment, a month after or years later, with another loss, you start grieving for the previous loss. And I don't know how these studies think, but I believe that after each miscarriage there is this period of mourning. Feeling guilty and blaming oneself is so common after a miscarriage. In the next few weeks of loss, moderate or severe depressive symptoms was reported in 36% of women, and they are gradually reduced, and they continue for 6 months and in some cases for one year. And we know that women who has a miscarriage is more prone to depression, 2.5 times more prone to depression. Women who have a high risk for depressive symptoms are women with a past history of depressive disorder, or women without children, women who have concerns about being infertile. There is a correlation between symptom severity and duration of the pregnancy or spousal problems. When there is a miscarriage, grief mainly focuses on the expectation of what may happen in the future. There is anxiety as well. This anxiety is very high in the first 6 months after miscarriage. Obsessive compulsive disorder and post-traumatic stress disorder risk is also increased in women who has a miscarriage. They have concerns about the possible causes of miscarriage, and they also have anxiety for future pregnancies. The divorce rate increases within 1.5 to 3 years after miscarriage. Of course, stillbirth is another pregnancy loss. The same applies to stillbirth as well, similar to miscarriage. That woman carries the baby for a long time, has plans for that baby, and when the baby is lost, there is a more prominent grief and mourning. It's either traumatic grief or complicated grief, and it can have a devastating effect on the couple's relationship. In cases of stillbirth, the rate of divorce between these couples is high up until 9 years after stillbirth. Risk factors for the development of complicated grief is lack of social support, presence of relationship problems, having no child, attitudes about the reality of the pregnancy. So complicated grief occurs mostly when pregnancy has been terminated due to fetal abnormalities. And there is the abortion, curettage. We rarely ask patients of their curettage or abortion history. Most people think that it's an ordinary or simple thing. However, it's one of the losses that people want to forget. They feel a temporary relief after abortion. However, a second loss may lead to complicated grief. The women actually rush into abortion decisions, and because of that they feel guilt and shame, and they make this decision without the support and assistance of their family or friends. After stillbirth or miscarriage, women try to find the cause of this event. They try to figure out why this happened to them. But on the other hand, after abortion, they have to acknowledge that this was their own decision. Grief usually goes with self-anger, guilt, self-punishment, and years after, during menopause, or if the woman is infertile, grief can also be felt. And if pregnancy has to be terminated for genetic causes, genetic reasons, then everything gets more complicated. In cases where the baby dies because of genetic abnormalities, the parents may feel even more guilty because of the transferred gene. dilation, abortion, amniocentesis are some of the procedures that the pregnant women have to go through, and this makes even things more complicated. And also PTSD, depression might develop in these women. When they are pregnant, women who have a history of pregnancy loss may experience desperation, depression, anxiety about being pregnant. And especially after stillbirth, it is common to have PTSD in women. So I was not prepared for someone else's presentation, and this brings me to the end of my presentation. Thank you for your patience.